This is the Real Health Podcast brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
Welcome to the Real Health Podcast. I'm Dr. Michelle Nisley, and I'm here today with our Chief Medical Officer, Dr. Drew Rose.
Hello.
And we're going to be discussing mental health. May is Mental Health Awareness Month, and we would like to touch on a few items with mental health. We talk a lot about physical illness on a regular basis when we're talking with co-learners. Often we're talking about physically how they're feeling, but we also like to tap into that mental emotional state that they are in. And so, Dr. Drew, I'm wondering if you can lead us off with the importance of mental health when you're working with a patient.
Yeah, of course. Something I spoke a lot about actually is the fact that I'm an osteopath. And the first tenet of osteopathy is, those of you who have seen my other podcasts have actually known that it is every person is a unit of body, mind, and spirit. So as much work that we do on the body, it's just as much work needs to be done on the mind as well. So literally 1/3 of the whole person.
Yeah, which is really, I feel, under treated in other situations.
And especially in today's day and age where the societal pressures of, glorifying the grind and, really putting your worth and your productivity, which all of these things are not necessarily the healthiest. It's thought patterns that we need to actually tap into as providers here at Riordan Clinic, just as important as looking at the labs. Trying to find ways to de-stress your entire life and try to focus more on the positive, I think, is actually just as important.
Absolutely. And I know the majority of Americans, I think, some statistics are up to 90% of Americans when surveyed really feel like mental health isn't well addressed by the medical system.
Absolutely. About 90% feel that their own mental health is waning, in fact.
Yeah.
So, and when you look at some of the statistics, kind of taking a step back, 1 in 4 to 1 in 5 Americans suffer from an actual diagnosable mental illness, but then only 14 to 25% actually are being treated. So there's a huge treatment gap as well within our own healthcare system.
And why do you think that treatment gap exists?
So historically, mental health has not really been looked at cohesively. So I have an article coming out that kind of outlines in the full paragraph, going through quickly over the eras of the evolution of healthcare, specifically mental health care in the United States, going all the way back to colonial times when mental health was considered a moral sin or moral imbalance. These people were thrusted into places like jailhouses, poorhouses, which then led to overcrowding, which then led to the need for asylums, which were supposed to be sanctuaries for a lot of these people.
Right.
Unfortunately, lack of funding and lack of resources and overcrowding led to more of a custodial care system, which then fractured, and then people became desperate.
Yeah.
That's where we had a lot of the modalities like electroconvulsive therapy, lobotomies, and insulin-induced comas, even as treatment modalities. Fortunately, ethics kind of caught up.
Right.
And then we had the medicine boom.
Yes.
So there's a lot that ties into what we see today, but we're still missing some pieces here. And hopefully the work that we do here at Riordan, at least the hope is that we can balance, again, the body, mind, and spirit and be a more cohesive structure.
Sure. And when you talk about the medication boom, you're talking about SSRIs and things like that, correct?
Yes. SSRIs, psychotropic medications as well, which we all know, at least from the history of Riordan Clinic, was an area of medications that Dr. Riordan didn't really appreciate as well.
Right.
Side effect profiles can be horrendous for some people, not all, but some.
Right. So in looking at when you're working with a new patient, for example, and we're doing some labs to go ahead and assess, what may be causing some physical ailments as well as mental, emotional ailments. Are there any tests that you're looking at in particular that help you hone in on maybe some nutrients that would be important as far as mental health is concerned?
Oh, absolutely. The vitamins are very important, especially vitamin D. We all kind of know about vitamin D, getting enough sun. You don't get enough vitamin D from the sun all the time. But the the correlation between vitamin D levels and mood stability, that is, has actually been studied quite a bit. But then other ones that you don't really think of, the B vitamins, balancing out your autonomic nervous system and detoxifying your body and just overall how you feel, the B vitamins can be incredibly powerful as well.
Yeah.
Some of the other sneakier ones that I think, the fatty acid profiles that can lead to chronic inflammation. If you think about it, body-mind connection, if you don't feel well, ultimately your mood starts to suffer as well.
Sure.
So the implications of the labs that we do here as far as on mood, we could talk about all day on.
Right. And I think most people don't realize that, when you're talking about serotonin production, for example, to turn 5-HTP into serotonin, you actually need vitamin B6 and you need magnesium.
Correct.
And so almost every biochemical reaction that occurs in the body requires both a vitamin and a mineral cofactor.
Right.
And so by assessing those, you may find that if someone is deficient, they're actually not able to produce some of the happier hormones, so to speak, like serotonin, or even some of those different neurotransmitters that induce calm.
Exactly. And it's kind of those common sense things from a provider perspective that I feel like can be overlooked quite a bit. Just because your magnesium level on a normal chemistry profile is quote unquote within reference range doesn't necessarily mean that you have the available magnesium to, balance out those pathways.
Sure. And magnesium, for example, is involved in over 300 different biochemical reactions.
Yes.
So everything from a lot of those different biochemical reactions that regulate mood, but also muscle relaxation too,
Yes.
right?
Yes.
And so when you're talking about being stressed and that muscle tension and everything as well, magnesium can be incredibly useful in helping us physically relax and then actually providing the amount of neurotransmitters that you need to biochemically relax as well.
Exactly. Magnesium tends to be one of those ones that I tell people, don't necessarily go crazy, but it's also really hard to overdose on. Usually because of that relaxation, one of the first side effects you're going to notice is looser bowels.
Sure.
So automatically if you get that, back off a little bit.
Yeah.
But for example, I'm totally going to call out my dad here, was able to get him off of Ambien. Sleep is incredibly important.
Right.
And when you utilize particular formularies of magnesium, specifically glycinate and threonate, you can take a moderate dose, about 400 milligrams, somewhere around that range. And you actually get some sleepiness. I don't really like to say sedated.
Sure.
Because especially for myself, if I take that, it kind of lulls me to sleep. But I've had my dog wake me up an hour and a half later, barking at the wind or whatever it may be, and I'm wide awake.
Right.
So, but it's just a natural way of getting yourself to sleep.
Yeah. And dose and the form of magnesium is really important as well. Both magnesium oxide and magnesium citrate, those tend to be a little more problematic as far as the bowel is concerned, but then also can be really beneficial if we have a patient who's constipated.
Right.
So finding the right form of magnesium and the right dose is definitely important. So I want to kind of parlay, then you were talking about sleep.
Yes.
So please talk to us a little bit about the importance of sleep and mental health.
Oh, sleep is incredibly important. I have said this from day one. Sleep is our reset button. Everything that happens, the amount of input our brains are taking in on a daily basis, even just minute by minute, is incredible. And our brains are efficient at siphoning the information we need to be aware of and kind of tucking back the other information in our subconscious. And if you don't get enough sleep, you're not able to really process all of that excess information that has been put into your subconscious.
Sure.
And over time, not getting adequate restorative sleep, that overall stress just kind of builds up on you.
Yes.
And you can start seeing that physiologically just by, dysregulation of your nervous system and gut issues and increased inflammatory markers. There's all sorts of different things that happen with that. Not to mention what that has the effect on with your mood. You're not stabilizing the neurotransmitters, which you need in order to be, fluctuating throughout the day normally. Cortisol, for example. Happens to be a very important hormone. Everybody thinks of cortisol like, no, suppress it all the way down. You need certain amounts of cortisol. And you have different fluctuations throughout the day. And without adequate sleep, you're not getting those adequate fluctuations.
Sure. And, talking about cortisol, people think of cortisol only being released when you're really stressed. But like you talked about, normally we like to see cortisol a little higher upon waking.
Yes.
And then kind of go decrease during the day, almost like a playground slide, right? And thinking about cortisol production, from a mood perspective, doing what we can to go ahead and decrease cortisol at night definitely makes sense so that you can get sleep. But there's a really large impact also on adrenal health and proper weight maintenance as well.
Oh, absolutely.
Yeah. So I think that that's something that a lot of people underestimate. They think, oh, I'm under adrenal stress, or, and they think of that only with regards to fatigue, but actually appropriate weight maintenance is very heavily dependent on the adrenal gland as well.
Absolutely. And not just, the adrenal glands also have a lot to do with the sex hormones as well.
Yes.
So everyone wants to run towards the hormone replacement therapies and say that, hey, my hormones are out of balance, I need this, and therefore I'll be healthier. When in reality, you could do something more like sleep hygiene and start there and really get a baseline of whether or not you need some sort of supplementation or not.
Yeah. I was on a podcast a few months ago, and normally this host normally asks, like, what's the newest, hottest thing? What's your favorite thing? Right. And I was like, sleep. Like making sure that you're getting a solid 7 hours of sleep at night. And that can be challenging as we age. There can be family members, there can be pets, there can be in perimenopausal women, hot flashes and things like that, and a lot of disturbances. So do you have any, a couple quick sleep tips that you like to offer?
Oh, I have more than a couple, actually.
I'm sure you
and
do.
Over my years, I am able to go to sleep pretty quickly, but man, I seem to always wake up at 1:30, 2:30, 3:30, somewhere in there. And for those people who have difficulty going to sleep or difficulty going back to sleep when you wake up, I kind of have like a 20-minute rule. One, don't watch the clock. That's huge. That's going to cause more ruminating thoughts. But if you're laying there for more than what you feel like is 20 minutes, and you're still wide awake and you don't feel like you're getting sleepy again, get up and go do something that is, menial. Don't go do something stimulating, but go put the dishes in the dishwasher, something you were saving for the morning, or go read a book, nothing backlit. You don't want a backlit screen with blue light.
Sure.
But even
why is that?
So the blue light actually will affect the neurotransmitters in your brain and actually wake you up. Light input into your eyes is actually what helps regulate your circadian rhythm.
Sure.
So another thing that you can do first thing in the morning, first 30 minutes that you're awake, try to get as much sunlight as you can.
Yep.
This becomes challenging in the winter months. This is why seasonal affective disorder is a big issue.
Yeah.
Get a mood lamp.
Yeah.
For those who have been in my office over the winter, you've seen where I have just a small square mood lamp, and I turn it on first thing I do. Right there in the morning, let my face get blasted with it.
Yep.
You're not staring straight in it, but you're still getting that input.
Correct. Yeah. It's shutting down melatonin or decreasing melatonin production, which usually makes us sleepy. I lived in Alaska for about 1.5 years, and that we'd eat breakfast every morning, and there was one of those sad lights, so to speak.
Yes.
But yeah, one of the full spectrum lights right there, and you don't have to stare at it, but it needs to be, even off to your peripheral vision for 15, 20 minutes will make a huge difference.
Huge.
Yeah.
Last couple too, real quick, that I think are pretty important because we all love our fur babies.
Right.
But it has actually been studied that people sleep better when they're not in our room. Not even just not in our bed, but not in our room. They need their own space just as much as we do.
Sure.
The other thing is charge your phone away from you.
Why is that?
Electromagnetic fields. So especially with the smartphones, it's actually been studied where the EM field around your phone will actually increase up to 10 times, I believe. Don't quote me on that, but around 10 times when it's charging.
Okay.
So if it's close to your head, you can kind of get some input there. It can dysregulate things.
Okay.
It really does show that connection of energetic fields and our own actual physiology.
And what if someone likes to have a sleep story or some sort of ambient music in the background? It's easy to get that on your phone, and also the alarm in the morning. So just put your phone further away and turn it up a little.
I usually say go back to the 90s when you can get like a sound machine or something.
Right.
This is where I'm okay, staying with the more quote unquote archaic technology. I personally have a sound machine that's completely separate from my phone.
Yep.
And if I don't have my phone in my room, which sometimes I feel like I need to for certain reasons, especially when I was a hospitalist.
Sure.
But now I actually leave my phone in the bathroom, which is a room just adjacent to ours.
Yeah.
So if you need to get a hold of me, I can still hear it
Sure.
if it needs to go off,
Yeah.
but at the same time, it's not right next to me.
Yeah. Let's bring that back around. So Dr. Rose was a hospitalist for 6 years?
6 years, not including residency. Yes.
Okay. So let's talk a little bit about how mental health, I mean, as a hospitalist, what your experience was with assisting patients with mental health in that setting compared to how it is in the outpatient setting.
Yeah, vastly different. The people that were in the hospital because of mental health crises tend to be more on the severe spectrum.
Mhm.
People with schizophrenic breaks, people who were unmedicated, unregulated, bipolar, people who were suicidal because of severe depression,
Sure.
people who are not able to function in the world because of severe anxiety.
Mhm.
And there is a unit for mental health, the BHU, the behavioral health unit. Typically, those were the people who were on psych hold for 72 hours
Okay.
because they were either a danger to themselves or danger to others in society.
Sure.
So at any given point in time, I would have at least one or two, I would say, mental health cases on my caseload per week.
Sure.
And those people honestly required most of my time compared to the ones who were ill with like sepsis or pneumonia or COPD. A lot of that medicine became algorithmic, whereas the mental health became highly individualized.
Sure.
And the causes for these triggers or these breaks range from societal, unable to get a job, unable to pay for housing, no support from close loved ones, financial, I mean, all sorts of different things, all the way up to substance abuse and just not having any kind of resources.
Sure.
So being able to navigate that in the hospital system took more of my own time as well as time from case managers to try to figure out a safe discharge plan.
Sure.
So it's time consuming. And if anything, it really showed the stress that it puts on the healthcare system that we have today.
Right. Right. Which I think still there's a lot of room for improvement in working with mental health challenges.
Absolutely. I do praise the psychiatrists that we had.
Sure.
It's not just consulting them because somebody is sad necessarily, but helping with the conventional side of medicine and getting those neurotransmitters stabilized, and then the social workers, the unsung heroes of the hospital system,
absolutely,
that help with the safety net programs, help with the fallback programs in case something doesn't work out. And also setting up follow-up.
Yeah.
I mean, it takes a ton to be able to get these people back out of the hospital and back out in the real world.
Sure. And so what I'm hearing, obviously, from that emergent situation, even for people who are not in an emergent situation, it sounds like it really takes a team.
Yes, absolutely. It takes a team. And I would say multiple providers and multiple other healthcare workers that can set these people up for success.
Sure. And so when we're talking about our approach here of the testing, there's ways to actually test levels of neurotransmitters as well. Talk to me a little bit about therapy, again, in building that team in the outpatient setting for your average person who may have some anxiety or some depression. Talk to me about the importance of therapy.
Therapy is singularly the most important thing, in my opinion, when it comes to mental health.
It's a big claim.
It is.
Yeah.
Words give feelings meaning. And I'm actually very open with the fact that I've been in therapy myself. I think it's something that people should be more open about. And fortunately, we're seeing more, the younger generations, especially, normalize therapy. But the need for a consistent therapist that you trust and feel safe with, finding that therapist can take time. It can be a tedious process. In fact, my very first visit with the therapist I was with for about 4.5 years, first appointment, she told me finding a good therapist is like trying on a good pair of shoes. You have to find the right fit.
Sure.
So it takes a commitment within yourself to say, I'm going to stick with this person for 4 to 6 weeks and really see how things go.
Yep.
And then also understanding that if you're not finding that you're clicking well, it's not a failure. It's just part of the process to find the next person.
Yeah, not all shoes are perfect fits.
No.
Right.
The other thing is it takes many weeks, if not months, to get out of that cycle of fight or flight or whatever is causing the major mood disorders or negative thought processes it takes months to get out of the autonomic system that keeps you in fight or flight before you can even begin the true work.
Sure.
So what I'm saying is it's a time commitment, and it is something that is absolutely an investment. And unfortunately, many therapists don't take certain people's insurance. And if they do take insurance, there might be a wait list.
Right.
It's an uphill battle that absolutely will pay dividends on the other side.
Well, and especially when you're thinking about some of the things that we've talked about, we're talking about some of the biochemical individualities, so nutrient deficiencies. We're talking about lifestyle factors such as sleep.
Yes.
And then when you're able to couple that with therapy as well, and just the more you can build, again, that team or those approaches, it just seems to be such a more complete, instead of putting a Band-Aid on a situation like an SSRI, not that medications aren't helpful, they can be incredibly helpful.
Yes, absolutely.
But when you're having this team approach and really individualizing things for somebody and building that group, it just seems like a very supportive environment that is going to not only help someone get past whatever current acute situation is happening, but then provide them with a better outlook as far as their long-term mental health is concerned.
Absolutely. I think when you look at mental health and the road that someone may need to go down to find that true health, it really is looking at every single aspect of somebody's life. Anything from what are you cooking in the kitchen? What are you putting in your body on a daily basis? How much exercise are you truly getting?
Sure.
Exercise is something we haven't touched on, but another lifestyle modification that can mean huge benefits for people with mental health issues.
Yeah.
Working out, getting that resistance exercise, getting those endorphins flowing, that has actually had bigger benefits on mental health than, some SSRI studies even.
That's correct. Yeah.
So, and you can get that almost immediately compared to some SSRIs take anywhere between 4 to 8 weeks to become therapeutic.
Correct.
So while you're doing all of these things and trying to find the right therapist, that might take months or so, a day-to-day thing that people can do is really evaluate what they're putting into their bodies. Try to clean that up as best as possible, because when you feel better, you think better. And then on top of that, exercise and sleep. Those are my biggest things that people can modify today to really find a shortcut, so to speak, not completely, but so to speak, to their own mental health.
Sure. And when you're optimizing your own biochemistry by eating a diet that's, high in nutrients and low in ultra processed foods and sugar, right?
Right.
Low consumption of alcohol, right? From a cancer perspective, the American Cancer Society recommends no more than a drink a day for men and no more than 2 drinks a week for women.
Right.
And so, moderate alcohol consumption, because again, alcohol is one of those things. Yes, it's a diuretic, but it also carries certain nutrients out, like those B vitamins that we were alluding to earlier on. And so I feel like building this approach really helps really lay the foundation for someone who, when they do find that therapist, that all of the other things are working in their favor, and they're actually going to get results faster than if they were only doing therapy or only correcting the nutritional deficiencies.
You're essentially healing the foundation of who you are before you get deep into that work. And that is honestly going to give you so many steps ahead compared to if you didn't start that work today.
And not only are you helping yourself from a mental, emotional aspect, but I'm assuming all of those positive changes would have positive physical ramifications as well.
Absolutely. You can see changes in your own biochemistry based off the labs that we do. You feel better. Your gut health is better. Just everything starts working more like a well-oiled machine, essentially.
Yeah, absolutely. And then lastly, I have to ask you about this because I know that OMM is one of the things that you are very passionate about.
I am, yes.
So can you talk to me, when I think of OMM or so one, if you can talk just a little bit about what OMM is, and 2, people may think of it as a physical modality, maybe to help with headaches or physical complaints, but can you talk about it from the mental emotional aspect?
Absolutely. So OMM refers to osteopathic manipulative medicine. We do have a podcast on that as well, but in short, it is hands-on techniques that can change barriers within the physical body, just so things are flowing better, essentially. So that's my elevator speech of what OMM is.
Yes.
But speaking from a mental health standpoint, there are techniques that work on the cranium itself that help with that cerebrospinal, that craniosacral connection, essentially. And when you open up the flow of the fluid, There's something that I believe it was Dr. Sutherford coined as the tide. It's basically that life force within you. Osteopaths that practice this consistently over years, decades. I mean, it changes and evolves the longer we practice this, but that tide is that life force that you can tell with certain people that have mental health disorders. That tide is weak. It's not balanced, or it's just not feeling like it's vitalized.
Sure.
Doing things like a CB4 release, opening up that cranial ventricle, the fourth cranial ventricle, and releasing that fresh cerebrospinal fluid from the brain down into the spine. It's nutrition. It is nutrition, not just for the nerves. It's not nutrition just for the body. It's carrying away the toxins, but it's also nutrition for that tide.
Sure.
And I've actually worked on people who have, refractory depression or bipolar, as well as schizophrenia. And doing some of these cranial techniques can be incredibly powerful. For those who don't completely understand what level I'm talking about right now, the other thing I always tell people, never underestimate the power of touch. The power of touch in and of itself can release things like oxytocin, which is that feel-good hormone.
Sure.
And helps people feel connected.
Yeah.
True connection, whether it be with loved ones, friends, a provider that you trust, a therapist that you trust, that provides safety to the nervous system and helps you heal.
Yeah. So the last question. So final takeaways. If someone, wants to make some changes today in their world that can help to improve their mental health, maybe they're not having frank depression or anxiety, but they're just feeling a little blah. What would be some of the highlights? Maybe 3 quick things that you would.
3 quick things.
Yeah.
First and foremost, touch grass. This has actually been proven scientifically to be able to elevate your mood. It may not be something you go outside and, everything is better, but you get outside and that kind of darkness, that funk that you're in starts to dissipate. It may not be all the way gone, but you can think a little bit clearer. 2, really evaluate your diet. Really evaluate your diet. I am not kidding. You literally are what you eat. And if you put good nutrition into your body will feel better, which can actually make you think better.
Sure.
It stabilizes your mood. And then 3rd, biggest one, sleep hygiene. Sleep hygiene is something I actually give my co-learners free reign to Google. What is sleep hygiene? What are some things that are recommended in sleep hygiene?
Perfect. Yeah.
That right there, I think, is going to give you a huge leg up on your own controlling and feeling empowered and being able to have some control over your own mental health.
Yeah. And again, just taking off from that, not only in your own mental health, but your physical well-being. Yes. All around. So thank you so much for taking time to speak with me about this.
Absolutely. Thank you.
Yeah.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.